So experiencing postpartum anxiety, that's horrible. And obviously it happens at a time that you probably expected to be on top of the world. And now instead you're experiencing lots of negative and scary things. And maybe you've even experienced PPA, postpartum anxiety, during your first pregnancy or previous pregnancy, and after your first birth or previous birth. And now maybe you're freaking out that it happens again. And that's just not the way that you want to go through such a special time. Now, there are several strategies that you can adopt to, at least reduce the impact once you become pregnant again. And I've tried to list some of these things, some ways that may be able to assist you, help you manage this, and hopefully in the best case scenario, completely avoid the postpartum anxiety during your next pregnancy. So first of all, it's very, very important that you educate yourself on signs and symptoms and also on triggers. It's important to learn more about postpartum anxiety. And of course, also to learn more about potential coping strategies. And I say potential because they have to fit you. Having some strategies stashed away in that metaphorical rucksack, to pull out when you feel signs or recognize triggers coming up, then they can aid you in overcoming, or at least, lessening these triggers. And understanding what you may experience can also help you, to prepare yourself and to manage this all better. So if you have suffered this before, or if you have clear signals that you are more susceptible to postpartum or perinatal anxiety, then it's really advisable to seek professional help. And I know that sounds a bit duh, but for a lot of people, there is, again, that metaphorical threshold to get over when it comes to verbalizing their mental health issues. So consult your healthcare provider, or maybe perhaps your obstetrician, midwife, or a therapist who specializes in perinatal mental health, or do a Google search for somebody maybe near you if you feel that it's too big a step to go to a professional person, or maybe there are more anonymous ways to approach somebody to talk to verbalize what's going on. There are online consultations. You can just have a phone call with them. You don't even need to tell them your name or show them your face, and they can provide you with guidance and support, treatment options. And then you can take it from there. That can be just that first initial step into giving you at least options to choose from, how to deal with this potential situation before it gets bigger and maybe even out of hand. There are many, many, many people that suffer from anxiety globally in this world. There are many more people out there that really understand at least parts of what you're going through. And, even if they don't fully understand you, I bet there are, lots of people in your neighborhood or online, social media ways that want to help you through this. So what I'm trying to say is building a support network, that is vital. Try and surround yourself with people that you love who can provide you with the emotional support and assistance during the pregnancy and also postpartum. I always say try and turn it around. If you found out that someone near you was suffering and they were suffering in silence, they didn't dare to verbalize it for whatever reason, what would you tell them? And most likely, you would tell them that they should have reached out to you, because that's what your network wants for you too. So please reach out and at least give them a chance to help you. So when you do this, also make sure to be very clear about what you want, what you need from them. And it's very important that you communicate that clearly and openly. If you have a partner, try and talk to them family, friends. Talk to them about your concerns, about your fears, about what you're feeling, your emotions. And sometimes just the act of sharing what you're feeling and thinking and what you're anxious about, that can prove to be a catalyst. It can help alleviate some of that anxiety. Maybe that's the first good step to hopefully getting rid of it completely. And what I also commonly advise is to attend support groups. There may be a local support group. I know we have them here via our midwife practice, but there are different options through different organizations. And many people also find, as I said before, that the online support via online support groups, social media, maybe Facebook, Instagram, they can also be very helpful, especially for people who find anonymity at this stage to be the safest way to go about it. They're mostly anonymous. That suits a lot of people. And because they're visited by so many around the globe, that's also another thing, that they are very accessible, that they'll be accessible around the clock. There's always somebody up there in the world, out there, up and ready to want to at least listen to you. And so joining those groups for expecting mums or new mums, it can prove to be very helpful. They will have many different levels of expertise and experience, which can prove to be reassuring and helpful to you. And maybe you find it hard to reach out to others, or you want to be able to feel, sort of sense of control that you can do this by yourself. And if that's the case, then a very good first step, or maybe as an additional step to the aforementioned advice, it could also be to develop sort of a self-care routine where you prioritize your self-care activities. By self-care activities, that could range from doing daily exercises or relaxation techniques or journaling or meditating. I used to love reading, for example, my favorite genre books to, sort of get out of my head for a bit. So think about, your favorite hobbies that bring you joy and peace of mind, and really try and make time to focus more on them, because that gives your whole body a chance to experience some downtime, and that downtime is then tailored to you and your needs. I don't need to tell you that staying healthy lifestyle. Yeah, I know that sounds logical to do this, especially, as you're probably watching what you're eating anyway, to ensure you don't eat anything that can harm your baby. But make sure to implement some joy into that healthy lifestyle. Eat the things that you really love too, and make sure to enjoy them when you do it. Don't feel guilty. Eat that chocolate if you feel like it. If you don't do it 24/7, do it. If that helps you, even for a little while, then do it, and try and do it guilt-free, because that's taking care of yourself in a sense too. Or do the exercises that you enjoy doing. There's lots of these clips online, or going to the gym and having to do all the exercises. Just do the ones that you enjoy doing. Don't push yourself into doing things that you dislike, because they will probably demotivate you at some point. And if you enjoy, like, for example, dancing, even if you're not good at it, then dance. I used to do that myself. I would dance around the living room by myself. Nobody saw me, and it really gave me a sort of sense of relief, temporary relief, but it gave me some relief. If you hate those Lamaze classes that you go to, then don't go. Seek an alternative that fits you better, because everybody else does it doesn't mean that you have to do it too. If it doesn't benefit you, then don't do it. There are so many options out there nowadays. So go explore instead of sticking with one thing that everyone else is doing if it's not for you. And again, no brainer, prioritize your sleep. Sufficient sleep, skip all the above if you must, as long as you get your sleep. Because as we all know, taking care of your physical health, that will positively impact your mental well-being. So prioritize sleep, but do it in such a way that you stay motivated and You get joy out of things, because that's the way it's going to have the longest lasting effect for you and for your health, and also for your baby's health, especially if you're still pregnant. Then keeping your mind in a healthy place, that's going to give your body the best rest as well, that the best of you, and that's the best place to be for the baby. Trying to stay in control, and let me rephrase that. So trying to stay in control of everything, that's often a huge part of anxiety, wanting to control everything. Delegating tasks, that may be something that's hard for you to do. I remember that was very hard for me, especially during the pregnancy, or parenthood in general. You want to stay in control. Hard as it may be, you could be relieving yourself of some of these anxious feelings by delegating some stuff, by delegating some of that control. And, take baby steps here. Start with small things. Start with making a list of those smaller things, and then a list of bigger things that you can start delegating when the smaller things go okay, when you find some trust in doing that. And don't hesitate to ask for help with things like household chores, with childcare or other responsibilities, because sharing that load, that can really reduce stress and prevent those feelings of overwhelm. Ask yourself why you don't want to share the load. What's keeping you of wanting to keep in control? What's keeping you in that control seat? And how could it be different? How could it be beneficial to you if you gave away some of that control? People very often really want to help you, so don't dismiss them because you want to keep a hold of these control panels. It's not an easy thing to do. I do realize that there was a point in your life that you were probably convinced that you were able to do all these things and that you had to keep the control tight to your chest. And just see what happens if you loosen those ropes a little bit and give some of that control away, and see what it can do to your anxiety levels. And a tip that you will probably read everywhere is to practice mindfulness. And honestly, that's one that I always find really hard myself. And that is because I'm just really not good at it. So giving this advice makes sense from, the more general point of view. I find it really hard myself. So I find it hard to give that as an advice. But what I do genuinely find very interesting is that we can trick and train our brains so that we start triggering it to make new neurological pathways. It's a bit of a long story, but anyway, engaging in certain more mindfulness related exercises, it can become fun if you approach it more in that way, that neurological way. I'll try and give you an example here so it makes more sense. So, for example, try to brush your teeth with your left hand if you're used to doing it with your right hand, and vice versa. Now, your brain really needs to think about these things, and you'll feel it once you start doing it. It feels really weird, but we can do it. We're so set in our ways that we sometimes forget that there are different ways that things can also be done. And that is in part what anxiety is to its core. We've sort of limited our choice in how we think about situations. It's only all the scary things and options that seem to come up when we think about certain situations, and we automatically dismiss all the hundreds of ways that we can potentially approach situations that don't cause us anxiety. And all these hundreds of different approaches, they surely contain many positive ways of going towards a situation, but we dismiss them because everything is ugly and scary, and we've sort of become used to that. We've sort of convinced ourselves of things always having to be approached from a don't get hurt, don't harm yourself, scary point of view. So by doing those small mindfulness exercises where we start to trigger our brain into doing things just very slightly differently from the norms that we ourselves have set. So like that brushing your teeth with the opposite hand, that can prove to be a first very small step to approaching situations in a different way, to start triggering our brain to think of alternatives. You could even, if the toothbrush doesn't resonate with you, try it with changing your baby's nappy. Do it with the different hand, or with feeding the baby his or her bottle. Try and doing it with your other hand or with the other arm, or maybe whilst playing with your wee one, then focus on, doing it with the opposite hand, or, try and sort of go from very small steps and build it up from there, and see what happens to the way your brain starts to think about situations. At this point, you're consuming this information I'm giving you, so I hope you are. So this is advice maybe seem a bit silly. What I'm going to tell you is to avoid excessive information consumption. And I'm giving you lots of information, but there are so many choices out there. And if you find something that fits with you, something that fits you and your lifestyle and your way of thinking, then try and stick with it, or at least try things out for a while before switching, because that's what we tend to do. We tend to want to come up with lots of different solutions, and then we want to try them all at the same time. So yes, it's very important to stay informed, but having said that, too much exposure to pregnancy or postpartum related information, especially on the internet, that can also increase anxiety. So I suppose what I'm trying to say is to be selective about what you read and what you watch. I'm saying that while you're hopefully watching this video. But try and be selective. And once you find something, try it out for a longer period of time so that you can definitely say it works or it definitely doesn't work. And that's when you start to look for alternatives. Because when you're anxious, it can really bring peace of mind to feel prepared. So for example, if you still to give birth, prepare a birth plan. That would be very suitable. You're probably already doing that. But also really make sure that it's your plan. So discuss your birth preferences, discuss them with your partner, healthcare provider, and make sure that your voice is heard. Sure, they are the professionals, but you are the one in charge. You should be the one in charge here. Your wants and needs should count double, and they should be aware of your anxiety, and that should make your voice even louder for them to properly listen to. And that feeling of being empowered and informed about your birthing experience, that can also reduce anxiety. Being honest and open about it, that can already prove to be a catalyst, because now you know that there's people around you who acknowledge it and will act on it, because they know what your preferences are, and they know why they are your preferences. And talking through a backup plan, because a birth will not always go according to the plan. That can also give you some peace of mind. Make sure to do some expectation management here. Your plan may not go according to what you want in the moment supreme, so make sure that you know about the alternatives so that you're not caught out by surprise, and that will later mess with your mental well-being. And consider therapy or counseling. Participate in individual or couples therapy during pregnancy to work through any underlying issues or concerns that may be contributing to this anxiety that you're going through. Also, breathing techniques can really help, and there are many out there. Again, find one or two that seem to really work for you and try them whenever you feel the need to. And repeating them often enough, again, that's a neurological story, that will make them like sort of a default setting, and your body will start to recognize when to do them automatically after you've done them for a longer period of time. That's why it's important not to go switching about millions of different breathing techniques, because I know there's lots out there, but trying to automate them can prove to be very helpful. When your body needs to activate your body's relaxation response. So when it recognizes that breathing technique that you've been doing over and over, it will hopefully do it automatically when the need is there. Also very important is to stay connected socially. If you have a good social circle that you move around in, make sure to maintain regular contact with friends and family members, and let them know, talk to them. They can provide emotional support, even if they just listen. Or even if it's just some great laughs. Laughing can do so much good for stress levels. Just a bit of release that you need every now and again to stay sane. Share your feelings with them. They are people, they're your friends. They want to share so that, they can care for you and they can give reassurance where needed. And again, and this one you're probably doing already, stay organized. The tip to create to-do list is probably a redundant tip, but I want to say it anyway. So make these to-do lists, set reminders, use calendars or phone apps to keep track of appointments. I installed some baby apps that reminded me what to do during which phase of pregnancy and birth. And enjoy it too, because it's all part of the experience. I remember that I deleted one of these apps and I was sort of sad that I wasn't going to use it again. And also, it may give you some peace of mind having them. Feeling organized can alleviate anxiety. And it can be also a gentle reminder for those moments when pregnancy dementia kicks in. We've all had that. Or let's not underestimate this one. They can also be a confirmation to you that you are on the ball, and they can give you some peace of mind just for, feeling organized in the moment or feeling ahead of the game. That can also alleviate some of that anxiety that you're going through. It's always good to know your stressors and to limit exposure to them as much as possible. What are your potential triggers? Do you know them? What steps can you take to make their impact less? Once you've discovered this for yourself, what triggers this anxiety? Share these triggers with the people around you and make them aware of how staying as far away as possible of these stressors, of these triggers, how important that is to your mental well-being. Set these boundaries. And that's also a great exercise for your future as a mum, where boundary setting that will prove to be daily business at one point in your life, in your future. So, that can also be very, very important. Another no-brainer I just thought of, and I think I've mentioned it before, is to prioritize that sleep. You may not be getting much of that once your wee one is born, and that is what it is. Sleep deprivation is probably number one, top on the list of any new mom and dad. You may not be getting much of it once your wee one is born, and that is what it is. So for now, during pregnancy, it can be wise to at least establish that consistent sleep routine and create as comfortable an environment as possible. And, there are so many things out there that can assist you in that, like, the special cushions or weighted blankets, special lights that can make you as comfortable as possible. And they contribute to your healthy quality of sleep. And they'll make you more comfortable at, let's face it, a less comfortable time in your life. So remember that rest that will help regulate emotions and again reduce that anxiety. So this is your chance to do that for yourself. Once the baby's there, things will change and there'll be more about the baby. So try and get yourself into a good routine now, and you'll benefit from that once your baby is born. Try and experiment with relaxation techniques. I've said this many times before, it's not one size fits all. So seek out what helps for you. Maybe some muscle relaxation techniques help, or, there's lots and lots of stuff out there for free on YouTube, guided imagery or aromatherapy, EFT tapping. That's also supposed to be very, very helpful. I hear many people about EFT tapping. So find what works best for you and try and make it a continuous thing in your life. Again, your brain will start to trigger you when it feels it's beneficial to start doing these things more automatically once you've done them for a longer period of time. Now, this one is extremely important. Be nice to yourself. I mean, you're doing this amazing, amazing job. You are growing this wee masterpiece inside of you. That's not nothing, So self-compassion for this super, super important and special thing in your life. Self-compassion is, it's the least you deserve. And if there would be any time in your life to avoid self-criticism, then it would be this time. What you're doing is nature at its finest. And really, I think it should be praised and celebrated all day long, every day. And I know that is a lot easier said than done. But, doing the opposite, being hard on yourself, putting yourself down, and not prioritizing yourself, that can have such a detrimental effect on you and on that little person that you're growing inside of you. So to remind yourself that experiencing anxiety during pregnancy is normal and you're doing the very, very best that you can, and you're doing an extremely important job, that's the least that you can do for yourself. Also, keeping track of, that's just come to mind, keeping track of how you're feeling. I'm sure there's plenty of apps out there to keep track of this. I remember that I was advised to do journaling and I just couldn't find the peace of mind to do journaling. So sometimes just to note down somewhere how you're feeling, that can help. You don't have to go into full out journaling mode if that's not your thing. What you could do also to save time is to keep it simple. You could make a wee journal where you give each day a grade from 1 to 10. And every couple of days or every week or every fortnight, monitor your grades. And over a longer period of time, if you see that these grades are getting lower and lower, that can be a signal that your mental health is suffering. So it's also, what I'm trying to say is to stay aware of where your mental health is at, and also to make others aware and seek help if you notice a decline or signs of anxiety or depression. Because early intervention, that can prevent symptoms from escalating. And you owe that to yourself, and you owe that to your loved ones and to your wee baby. I've said it before, it's not one size fits all. So literally every body and every pregnancy and every birth, every brain and postpartum experience is unique. And some of these strategies will work for you, others won't, and that's also okay. You are your unique self, so it's really essential to tailor these strategies to your unique individual needs. So always remember, there's help out there when you feel that you're struggling. So please don't hesitate to reach out for professional help if you feel that you need it. Take care.